Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Azy and Dr. Arezoo Nasiry show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Hi everyone, this is Azy.
And this is Arezoo.
And we are the Smile Sisters.
We are. And today we're going to be talking about a huge topic, which is a smile makeover. It seems to be like an all-encompassing word, but what is it really? What's a smile makeover?
Yeah, well, that's a good question. And the answer is confusing because it can involve a lot of different things. So a smile makeover can be anything that basically enhances your smile. You know, it can go anything from having a full set of veneers or crowns on all of your teeth to as simple as just getting a really good cleaning. Like if you have some gum disease and your gums are bleeding and swollen and red, just getting that sorted out can be a smile makeover because it can make your smile more beautiful.
Right. A healthy smile is a beautiful smile. We always say that. So got to start with the health part and then add the beauty part. So what are some of the things that someone should think about if they want to enhance their smile? Like what are the steps or what are the things that a person should do? Like what's the first thing?
Yeah, that's a good question. So the first thing is to go in and see your dentist. And if you are thinking about a smile makeover, you really want to go see somebody that has experience doing cosmetic dentistry and smile design. But really the most important thing is to have a healthy foundation. So when somebody comes into my practice for a smile makeover, I'm looking at two criteria. The first one is I'm really trying to figure out what my client or my patient is looking for. It's such an important psychological part of this to understand what is their goal, what's in their mind's eye as to what they want to get.
Right.
So often we're looking at photos. I ask people to bring photos of smiles that they like. Often they're bringing photos of themselves when they were younger. And also we have a whole bunch of photos of smiles here that we look at. So that's the first step. What is it that you want? You know, I might look at a smile and think it is almost perfect. And then the client is like, no, I want him to be whiter. I want him to be longer, this and that. Or I might see somebody that has a more yellower smile, their teeth are crooked, but they are completely happy with how their smile looks, and that's perfectly fine.
Right.
So it is about what you want. And then the second step is getting the foundation right. So figuring out what is happening underneath. Are the teeth healthy? So I make the analogy of, let's say you're going to a beautiful party and you buy this beautiful ball gown that you're going to wear, right? What is the first step? Is that you take a shower so you have a clean body to put this beautiful dress on. So It's the same with your teeth. We're not going to dress up a bunch of dirty teeth with veneers. We need to make sure that that foundation is healthy. So that means getting a full exam with x-rays and making sure that you have a healthy set of teeth and gums to put veneers on or whatever it is that you want.
So now you mentioned veneers, and that's another like one of these all-encompassing terms. So what are veneers? Like, are there different kinds, or what exactly are they and what do they do?
Yeah, so veneers are a layer of material that's put over your teeth, right? And so the word veneer can relate to, you know, construction as well, veneering your
like
cabinets.
A wood veneer.
Exactly, right? So it's the same thing. And often I tell people, think of it like a fingernail added to the surface of your teeth. So it's just a surface layer.
Right.
But it can be made out of different materials. And the two main materials in dentistry are composite or resin. Sometimes this is referred to as bonding.
Right.
So we're just putting a layer of filling material over the surface of your teeth. And then the second thing is you can do it in porcelain. And then that's usually fabricated by the lab. And we have porcelain, which is like a glass-like material that is then bonded or glued onto the teeth.
Right. So we talked about getting your teeth healthy and what veneers are, but what other steps can we take? Like what can we do to enhance our smile other than just like getting a cleaning or getting veneers? Are there other steps in between that we can do?
Yes. So once we figure out that the foundation is healthy, right? Your gums are healthy, that you don't have cavities or infections on your teeth, the structure is sound, then we can talk about how to enhance that smile. So I get a lot of patients who come in and they have really crooked teeth. One of them is rotated, is one sticking out, one's in, and then they want to fix that by veneers. But really, we always want to be addressing the problem that we have by addressing the cause of the problem. So if the cause is that your teeth are in the wrong position, then the solution ideally is to move the teeth into the right position. So something like Invisalign or braces can be a smile makeover,
Right.
because we're aligning the teeth. If the cause is that the teeth are chipped, cracked, really discolored, where we can't just whiten them, and we want to really change the shape of them, then the solution might be something like veneers, so
Right.
an additive procedure like that.
Okay, so just depending on where you're starting out and where you want to be, there's like a host of different things that we can do.
Yeah, so figuring out what your goals are, figuring out what the problem is, and then combining those two, marrying them, so we find a solution that is healthy, that is going to last a super long time, and it's going to address the problem that you had. So those are really important.
What are the ways to make it last? Because that's another issue, that when you get something done like this, you want it to last for many, many years. And what are some of the, like, how long do these things last?
So that is a critical part of finding a provider that has a lot of experience. So there's a lot of travel dentistry. People fly out, get stuff done cheap, and come home. But the issue is they're not looking at you in the long term. They're just slapping on a veneer, basically, over top of whatever you provide to them. So that can be a huge problem because of longevity and also accountability. So you want to find a provider that's there. So if something that's done chips off, breaks, stains, discolors, you want to have a provider that's going to be accountable and be able to fix it for you.
Right.
So I always advocate for finding a local dentist and someone that's good at this, and sticking with them. So that's one of the most important parts.
Right.
Just having someone in town makes them accountable and makes them produce dentistry that's going to last, because they don't want to be redoing things. So I think that's critical. And then the second is the choice of materials. If you want something that is going to remain shiny and beautiful forever, and it's not going to stain, it's not, and it's long lasting, then porcelain is sort of the most ideal that we have.
Right.
This is with veneering the teeth. But bonding, which is made out of filling material, can also be super successful and beautiful, and it can last you 5 to 10 years.
Okay.
The important thing is to find a provider that's really adept and good at doing that kind of work, because it's very, very technique sensitive.
Right. You have to know what you're doing. You can't just slap it on, like you say.
You have to know what you're doing. You have to know the materials that you're using. That's really important as well.
Okay, so we've talked about smile makeovers, the different materials, but really these things are life-changing, right? And we've both seen people that their whole personality has changed because they've enhanced their smile. So can you share one of your stories of one of your best cases?
Yeah, honestly, I mean, I live for the moment when I hand the mirror to the patient and they take a look. I mean, the whole team gathers. It's such an exciting moment for us, and it's why we do this day in and day out. You know, my biggest trigger is when somebody sits in my chair and says, you know, I hide my smile, or I don't smile with my teeth, or I cover my mouth. You know, I have patients who we're trying to do the initial consultation, which involves taking photos of their smile. And I have a really hard time having them just smile for the photo so I can evaluate their teeth, or just give me a smile in the chair.
Right.
So that's always the question that I ask, you know, how do you feel about your smile? And if they say to me, I hide it, I know that I have to go in there and do something. So that's how
Right.
I know, you know, it's not about how I feel their smile looks, but it's about understanding how they feel about it.
Right.
And then I know I need to do something and go in there.
Right.
And it's remarkable the difference that you see. You see it in their eyes when they smile, when it's done. So we do before and after photos, and we're focusing on the teeth, but really you see the brightness in their eyes when they have this confident smile. You know, I've had patients who get a smile makeover, and then they get promotions. They find a partner. And why is that? It's not just about their teeth, but it's about the fact that they feel confident
Right.
enough to
Their
look someone in
confidence
the
goes
eye and smile and talk without having this thought that their teeth are, you know, not up to par.
Right. I have one patient comes to mind, Julie, that really she only had one discolored front tooth, and she was a young, beautiful person, a new mom, and she finally decided to change that one tooth. I mean, we're not talking like 20 veneers. We're talking changing one tooth. And that made all the difference. And she was like in tears after seeing that one tooth matching the rest of her teeth. I mean, smile makeovers don't have to be a huge thing. And she was just like, I wish I should have done this sooner. I mean, it's just one tooth, but it makes all the difference. It's crazy how little changes can have a huge impact in how you look and how you feel.
It's absolutely amazing. And
Yeah.
you see the life changes.
Yeah.
And, we usually have these patients come back 2 weeks after we've delivered their veneers or whatever to do their final photos and check their teeth and everything. And you just see them walking in, their hair is done, they have more makeup and they're just
on.
smiling.
Yeah.
It's absolutely fantastic. And I can think of a more dramatic case, Jesus,
Yeah.
who we worked on together
Yes.
with implants and then finally a full smile makeover. And when he would come in at first and we were doing the treatment, every time he would laugh, he would put his hand automatically.
Yeah.
It was a reflex.
Because he was missing a bunch of teeth.
He was missing a bunch of
Yeah.
teeth. And now he is smiling, from ear to ear. So
Yeah.
it's really uplifting for us as a team
Yeah.
to see the changes in the
Yeah.
patients.
So if people have questions about smile makeovers or what they would need, what's the easiest way to reach us and to get some information?
So at our practice, we usually start with a virtual consultation. So that's really easy and it's free. You can go online and just book it. And it's just to kind of get to know you and figure out if there's something we can do to help you. So we're just really talking about what your goals are. After that, you get to come into the practice and we do a full consultation where we take some x-rays and do a good evaluation. And from there, if we decide that a smile design is what we're going to do, we will create a smile makeover design and we can go through the steps of how to show you that.
Okay. But first, we start with the virtual consultation. And to get that, you go to ladentalclinic.com. Just click on book an appointment and virtual consultation, and one of us will pop on the screen and chat with you. No charge.
Yes, that's right. Very easy. Do it from your home.
Thank you all for tuning in to our episode. I hope it was useful, and we look forward to seeing you next time.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.